Hi everybody, this is Tom Shamborn, VP of Marketing for Instructional Technologies. It is 10 a.m. and it's time for our webinar on workers' comp training for managers. Thanks for attending. We're going to take a few minutes to go over some quick webinar housekeeping notes for you while everybody finishes rolling in here. So a few things really quickly. We're recording today's webinar, and so we'll be making it available probably on YouTube afterwards. It'll also be on our site, and I will email a link to everybody who attended as well as people who didn't attend. I've muted everyone. Hopefully I haven't muted myself. If everybody can hear me, let me know. So if you have any questions or concerns, go ahead and put it in the chat or the questions window there on your GoToWebinar control panel. I'll be monitoring that separately while we listen to Bob Howell, who is joining us today. Bob works with us to develop our manager training courses on workers' comp, and on reducing it. The courses are aimed at frontline managers as well as C-level executives, and the idea is to dramatically cut your paid temporary total disability days. Bob has 30 years experience working with the transportation industry to reduce overall costs of workers' compensation, or workman's comp, depending on what you want to Google. He spent 18 years with the risk management behemoth Marsh & McLennan as the workers' compensation consulting manager for their national transportation practice. Some notable clients with whom he's consulted include Broadway Express, Ruan, Ryder, AAA Cooper, and CF Motor Freight. And with that, I will turn things over to Bob. Bob, the mouse is yours.
Thanks, Tom. Now, you want to? Yep. Yeah.
All right, we're going to close this so Bob can actually see the screen that he's working on.
Perfect.
There we go.
Good morning, everybody. It's actually morning here in Vancouver, Washington, but thanks for attending this webinar. Let's talk about the program objectives first. We want to significantly reduce lost time days and days on transitional duty. Minimize denials and resulting litigation. Create a culture that will support this. Immediate cost savings. And when I say immediate cost savings, the first day that your managers adopt the principles of this program, their cost savings are going to come down. And we've had some great success with this. Actuaries have validated the work we've done. As a matter of fact, I was asked to go down to Atlanta, Georgia to explain what we had done to this one very large LTL carrier to reduce their workers' comp costs so much. And I just told them we got operational managers to adopt the principles of this program. People have other notable things. Companies have put this in their annual reports. Companies have set up shareholder meetings to explain the cost savings, the immediate cost savings they got. So we have a great track record in reducing the costs. Webinar focus, the importance of a cultural shift in operational managers, how to get it, and the appropriate actions at the time of injury while off work and on transitional duty. The doctor's perspective, which is, you're going to see this is probably the most important issue here, is getting the doctors to decide with operational managers. The cost of lost time versus transitional duty, and you're going to be surprised when you see this, I think. Malingering versus fraud, and the psychology of lost time. Manager-driver relations, most are good. I mean, I'm pretty sure you'd all agree that most relationships between manager and drivers are good. But what happens to the relationship when a lost time claim is filed, or any other workplace issue for that matter? Manager reaction, why some managers react negatively to a notification of a claim? Well, they noticed other workplace issues with the employee before the lost time claim. So they're suspicious about it. They believe the doctors, the workers' comp system, and lawyers are all heavily sided in favor of the injured employee, and their compensation is negatively affected by it. That's important. I mean, managers are driven by their quarterly bonuses and such. So now here's the problem. managers and executives may not understand how the workers' comp system works, what the treating doctors can and will support, the most effective method of minimizing lost time costs, and they try to deny claims, which pushes them into litigation, resulting in increased lost time durations, and the importance of their professional involvement. They don't understand the importance of that. This is one of my favorite slides in this presentation because managers want to teach their lost time employees a lesson with denials and litigation. But in these circumstances, it is the doctors and the lawyers who actually teach managers a lesson with extended lost time and disability awards. So we're going to talk about the necessary cultural shift. Managers need a cultural shift. They need to learn how to get the doctors on their side, react to lost time claims professionally, focus on getting their employees back to work ASAP, and they need an education on workers' comp 101 from a management perspective, not from a legal perspective. And they need a better understanding of lost time math. Let's talk about lost time math here for a second, excuse me. Because there's a big difference between the cost of transitional duty and lost time. When an insurance company actuary adjusts paid losses at 12 months, they multiply the paid TTD by a factor of 7 times. Let me explain that differently. Let me just keep going here. And there is no adjustment for transitional duty payroll whatsoever. So managers think that when a person's off work and we're paying them through the workers' comp system, and they're on paid TTD, that there's no financial difference between that and transitional duty payroll. Well, that's not true. It's a factor of 7 times. So the actuaries are going to hit paid TTD by a factor of 7 times. So there is a payroll when a person's on transitional duty, but it's 6 times less expensive than having them off on lost time. Very important. Client comments: we already had a return to work program, but we didn't have consistent support of it. The manager-employee relations have improved overall. And by the way, not just in the area of workers' compensation, but in other areas, other problematic areas as well. So this doesn't just teach managers how to be more professional and give them the motivation to be more professional with their drivers and employees. It fixes it in other areas as well.
Hey, Bo, hang on just a second.
Yeah.
I'm going to move this speaker a little closer to you because apparently hearing from a few folks that our volume is a little bit low. Since you are facing that direction, we'll put this in your line of light.
Now, yeah, the third bullet here, we were able to use this approach on our existing lost time claims as well. That's very important because we don't just reduce the cost of claims that happen from this point forward. You can actually go into your existing lost time claims and get operational managers involved and reduce those costs as well significantly. Manager involvement. So this is a manager-based return to work program, but what are we talking about here? Are we talking about managers taking full control and responsibility over workers' comp return to work efforts? Yeah, the answer is no. All we want them to do is support return to work efforts and push for earlier return to work. We want them to talk to their employee, ask them questions: how are they doing? Manage their transitional duties while they're on transitional duty. Multitask them, which is simply just moving the employee around to different tasks. Don't take the employee and put him in a closet and have him counting paper clips. I mean, I realize the industry is much better at doing this now, but don't, talk to him, pay attention to him, and maintain a professional workplace environment for that employee. So let's talk about distributed workforces for a second here. Let's say the driver is domiciled 50 miles from the operation. I know we have some truckload operations on this webinar. The rules say that you can't mandate transitional duty. You don't have to. You can ask the lost time employee to come in. The rules say you can't mandate it, but we're not mandating anything with this program. Have the employee come in, pay for a hotel and travel, and stay focused on the employee's physical and emotional recovery. Because once the employee figures out that they're not going to have extended lost time, they're going to go back to their driving job much faster. And get managers involved with calls and face-to-face discussions.
Hey Bob, can you talk a little bit real quick about the difference between sort of mandating them and asking them to come in?
Yeah, asking is everything. Because, again, if managers are more professional, we're going to talk about the treating doctors in just a second, but when managers are paying attention to their lost time employees in a functional way, and they're asking them to come in, and this is in the trainings, the video trainings, it's very powerful. We've had reports from managers saying, you know, I had 7 drivers not show up for work the other day, and I used this principle of calling him up and asking him to come in, and he got 5 of them on the phone, and 4 of the 5 came back to work that morning. Now, as it relates to transitional or lost time employees, it's a very powerful thing to the employee to have their manager ask them to come in. I mean, in a workers' comp situation, employees are fearful. They're afraid they're going to lose their jobs. That's kind of one of the main reasons they file workers' comp claims in the first place, is they think they're going to lose their jobs, and they're protecting their income. So, good point, Tom. This is an interesting thing. We're picking on managers here, being pretty tough on managers here. But in every company, there are 1/3 good, 1/3 average, and 1/3 poor performing managers relative to lost time. And this could apply to every other management issue in the company, every other. But let's talk about lost time management. What these trainings are designed to do is get the 1/3 average and the 1/3 poor performing managers much better at minimizing lost time. And as I talked about the actuaries earlier, they saw this. That's all we're doing, is getting the 1/3 average and the 1/3 poor performing managers much better at minimizing lost time. ProTread developed 3 20-minute training courses based on my 30 years experience, and they did an absolutely fantastic job with that. It gives managers the skills and the motivation to focus on creating a positive environment for lost time employees to return to, one that doctors can and will support. And that's very important, because that's what we're after here. It's the doctor that's the gatekeeper on return to work and such. So, matter of fact, I'll tell you a story. We had a conference and a big training session on the island of Kauai, and we invited all the clinics to a conference like this. It wasn't a webinar, but it was a meeting. And I walked in, and the last doctor came in. There were 12 doctors in there, and one of the doctors said, well, if we're here to talk about return to work, I'm not going to have any part of it. And I said, why is that? He says, because the relationship between my patients and their managers in this facility, it's a big hotel, is horrible. Managers treat my patients poorly, and if that's the case, I'm going to send the employee home. This reverses all that. This is going to change that. So what we're saying here is that the cause of lost time in many cases is the poor relationship between the manager and the employee. Now, we're not saying that the employee didn't create that poor relationship. We're saying that managers should step up and create the positive professional relationship with the employee, one that doctors can and will support. The training courses are interactive. Participants are required to click on the next topic in each one of the 3 lessons. The first training series talks about the origin of the workers' comp system and its purpose. It talks about the workers' comp math, like I discussed earlier here. The facts about lost time, common beliefs and perceptions of management. Again, the importance of manager involvement, because that's what the doctor's looking for. And maintain focus on getting employees back to work.
Hey Bob, can you talk a little bit about the where workers' comp got its system and sort of that misperception about, how managers tend to think that it's there to really, put the company under duress. But you have sort of a more interesting and nuanced take on sort of the origin of where workers' comp came from and how it helps for managers to kind of understand a little bit more about why it is the way that it is.
Yeah, thanks, Tom. And we go over this in the trainings. we show managers that it was the employers who invented the workers' comp system. And they did so because they were being sued by their employees, and it was bankrupting the companies, and it was actually hurting the employees too. So employers struck up a compromise with labor unions and said, okay, we're going to build laws in each state. This all started back in Wisconsin. We're going to build a system where it's a no-fault system. So the employee can't sue the company, and the employer can't fire the employee for having workers' comp claims. And it works out. This is a good point, Tom, because that's what managers believe. Managers think that when an employee hires a law firm, that they're suing the company. They're not. They're hiring a lawyer because someone's denied their claim, and they're trying to protect their jobs. I mean, most of you I think know that, but I'm not sure your managers do. So, or at least all of them. So, okay. So the first training slide. Let me go to the second one now. We want earlier releases to transitional duty, and this motivation for this is we're going to put this in the motivation, give this motivation to operational managers. They're going to want to get that employee back sooner. If the doctor authorizes 10 days off, let's say on off work, we're going to push the envelope on that and say, well, doctor, we know Bob, and Bob has a farm, and he's going to be out there working on a farm. If he comes back, you send him back to work here, we'll make sure he works within your restrictions. But we talk a lot about the treating doctor's perspective, that the doctors, in fact, if operational managers do the right things and are professional with the employee, the doctor will cooperate with that. And by the way, in that scenario, we talk about this in the trainings, that it actually neutralizes the workers' comp system. There's no need for litigation. There's no need for denials and stuff. What are you denying? The employees back to work. We'll talk about the manager's perspective, workplace hostility, and that does work. I mean, that does happen in the environment, workplace environment. We talk about how to not get angry with managers. We talk about fraud, malingering, and abuse, the employee's right to legal counsel and why they seek it, and privacy laws.
Bob, I want to ask another question here for you. You talk, and it may be in the next slide, I'm not sure, but you talk about how one of the things that the training recommends is that it's not recommended to have those frontline managers talking to the doctors.
Right.
That should be handled by somebody either in HR or in the risk management group or in the workers' comp group if there's such a group within the organization. Can you talk a little bit more about how that information should sort of flow back and forth between that frontline manager and the other person, and why it's such a benefit and why you recommend not having that frontline manager do it, other than obviously they've got plenty on their plate already?
Yeah, they're busy. Managers are very busy, and they're going to look to the local HR people and safety people, whoever. There's probably already somebody at every one of these companies who are attending here who have a person who's in charge of talking to the treating physicians. And as I talked to Sheila and Jan the other day, we want managers we want to show the treating doctors. That's all we want to do. Show the treating doctors that our managers, the managers in your companies, they're going to treat that injured employee, that lost time employee, with the utmost professionalism. Again, it's the first thing the doctor is going to ask them. So it's very important. But no, they're not going to be calling. And we do recommend in the training that if the person is seriously and legitimately injured, that the manager go visit the employee in the hospital, or call them or talk to them. It's very important. It's kind of amazing. Over the years, we've learned how important it is to the employee that they have a relationship and they're respected by their manager and supervisor. It's very important. A manager can ruin an employee's weekend by just a few comments. Okay, did I answer your question?
There's a good cliche, which is that employees don't leave companies, they leave managers.
Oh, clearly.
Can you talk also real quick about sort of that workplace hostility and sort of beyond necessarily maybe what the culture of the manager culture that the manager is establishing, but what the workplace itself. Like, can you talk a little bit about what that hostility, how it can manifest itself, and what managers can do to try to nip that in the bud?
Sure. You know, managers get frustrated when believe me, we know how. I've been to hundreds of trucking companies, and I've seen managers, and they're frustrated with workers' compensation. They don't understand it, and they're even more frustrated when an employee doesn't do what they tell them to do. When they file workers' comp claims, when they have accidents, and when they're talking to the employee, in their frustration, they get a little bit angry, and then they start to spool out of control. And what happens? There's a physiological problem that the situation takes place. Most men, when they get angry in the beginning stages, we start to hold our breath, and then the brain sends a message down to the heart to releases cortisol, which is a nasty solution in our bodies, and it makes us we hold our breath further, and there's more of this cortisol being put in there, and then the manager spools out of control. So there's the process in the trainings where we talk about breathing. And the importance of that manager to breathe when they think they're getting angry or they're whatever, to keep breathing. Because if they don't, they're going to spool out of control and there's going to be an argument. The employee is going to go to the doctor and say, my relationship with my manager is terrible. So this is actually something that managers can use not only in the workplace, but at home, with their children, and by the way, on other issues too, not just workers' comp. So
that's funny. I was going to say, it sounds like, no, go ahead. Sounds like that sort of thing that I could probably use with my 4-year-old.
Oh, clearly. and you know, now the first 2 sessions kind of explain everything to managers, what they should do, and we want them to be more professional and talk to their employees and so on. The 3rd training series really gives them the skills to do this. We talk a lot about communication skills. Communication skills aren't yelling at the employee or disciplining the employee. Communication skills are both ways. And Tom brought up a good point a few minutes ago. Ask the employee how they're doing. Very powerful. How are you doing? Are you getting better? Listening skills, everyone talks about that. But the impetus of this program is to get managers the motivation to do these things because they work. And reacting to all workplace issues. I mean, I've read hundreds of books. I'm sure most of you have too, about how to be better managers. How do we come? I'm very active on LinkedIn, and everyone says, how did we get so many bad managers in this industry? Well, they don't have a motivation. No one's given them the skills or the motivation to be better managers, better communicators. And as I said, started to say, I've read hundreds of books over the years, and not one book, not one chapter or one page talks about anger or yelling or shouting at an employee as an effective management skill. Just the opposite. This series of trainings are designed to change that in operational managers. We talk about, and we just talked about the anger management solution, which is to keep breathing. And we even mentioned the company that developed this program. It's called the Institute of HeartMath. Anyway, building functional manager-employee relations and human factors. Human factors is an interesting find for us because about 20 years ago, I did some research on this. And matter of fact, it was a writer manager, site manager, who said, you know, I can predict these claims. I can predict workers' comp claims, and I can predict accidents. I said, what are you talking about? He goes, there were situations leading up to that claim or that accident, you know, personal issues, the person was late, or there were arguments in the workplace, so he could predict that. And to take this one step further, again, remember I talked earlier, the managers know that there were underlying issues before the lost time claim or accident. Guess what? The doctor knows that too. But that nothing's ever brought them together to understand that, hey, we both understand that. Now how do we manage that person back to work? Anyway, let's go back to the Navy here. They study the correlation between personal workplace issues and the likelihood of an injury or accident occurring. They call them mishaps. And they have data, extensive data, that shows that 77% of all U.S. Navy mishaps are directly correlated to these personal problems of their shipmen. And so this is, and again, the managers know this, but they don't know how to react to it. So what the trainings teach managers is, if you notice a personal issue coming up, or an employee is not acting correctly, or you hear some hearsay about the employee, talk to them about it and avoid the injury. So, and I went online the other 2 months ago and looked at how many injuries and accidents had a manager-employee dispute prior to that accident or injury. And a lot of them do. Well, 77% of them did. So let's keep going here.
Before you go too much further, can you talk a little bit about, at the risk of sounding like the marketing guy, can you talk a little bit about how this training, it does more than improve your workers' comp, your TTD numbers. You talked about it, reducing, sort of future claims, because people realize that there's not that sort of free ride anymore, that the company wants to welcome injured people back, that we do understand that people do get healthier once they are back in the workplace doing some sort of transitional duty, and that these other sort of managerial skills tend to bleed over into other parts of job performance.
There's a couple things. Good question, Tom. There's a couple things that are interesting here. Once employees start to view, current employees that is, start to view that they're not going to have any kind of a win by filing a workers' comp claim, a frivolous claim, and having extended lost time, because I saw John and Bill and Steve do that, and they brought them right back to work, and they got releases from the doctor to come right back to work. What happens is that reduces the number of future lost time claims, because there's no win for them. But the other thing is that their managers aren't being aggressive with them. They learn how to communicate with these people. So that's a causal effect for people to file workers' comp claims in the first place. But, and so the third thing, we're going to talk about this in a few slides, you want to make sure that new employees understand this, that we have a marvelous safety program here. If you do get injured, we're going to bring you right back to work, because we're going to take care of you. So we're going to teach the new employees that there's no basis or no gain for filing a lost time claim, because you're going to come right back to work anyway. Which is, by the way, just so you know, is absolutely the best thing for an employee. And doctors know that. They know that getting the person back to work as soon as possible, faster than normal, is better for them than staying at home. And they understand that, as long as the relationship between manager and their patient is good. And you should advertise that to treating doctors as well, that you've got this cultural change that's taken place, and that you have full management support of your return to work. Okay, here we go. Managerial support. If a manager doesn't support this approach, they can't reduce their lost time days. They're going to stand out because of it. But most managers will, because the trainings demystify workers' compensation for them. And this is much easier and much more effective than what they're currently doing. At least the bottom, the average 1/3 and the bottom third. It's much easier for them and less frustrating. They're actually managing a problem and doing it effectively. So,
Bob, you've told stories when we've talked before, that one of the benefits of this is that the morale, not just of the employees, is improved, but your manager's morale is improved, because they have skills and they have options for dealing with this sort of thing, and it just lowers the overall drama of the workplace.
Right. Here's the important point. Somewhere in the organization has expressed frustration with the workers' comp. Somebody in management has expressed frustration about workers' comp and lost time specifically. That feeds down to the supervisors and everybody else, and it's very frustrating for supervisors to be forced to yell at someone or go after an employee because he turned a claim in. It's an uncomfortable situation. This actually improves the morale of management too. You're right, Tom, because it's much easier, straightforward, and you're actually managing a problem. Sending a person off on transitional or on light off work, putting them out there and on lost time is not managing that employee. And it's frustrating. And so this does give. We hear it all the time. I can actually manage the employee now and get them back to work, and I can like the employee. Because if you get down to the supervisor level, they know that employee has had some personal problems, like they've got a sick child or financial problems at home, and they know, and so that they can't support. It's uncomfortable for them to support a program where you're going after those kinds of employees with those problems. So, okay. Who should take the courses? Well, anyone managing drivers or employees, department heads, CEOs, CFO, chief counsel. Yeah, I mean it too, CEO. They're very simple and straightforward to take. And also the managers who already apply the philosophy of these trainings, the upper 1/3 that I talked about. Because there's valuable information in these trainings that they can use that they probably don't know about already. New promotions, managers and supervisors, and again, I said this earlier, new drivers should know about this program. So keep going here. Implementation. Sheila and Jan, I think you're on the call, they said, okay, Bob, we like this program. What's our next step? And I said, well, we'll set you up with the video trainings, and you can just start giving them to people. Well, I know better than that. There's actually an implementation process that's necessary to get buy-in from all levels of management. The first is a presentation to senior management. You've got to tell them about this cultural change, which I think they'll love to hear because of the potential cost savings. Kickoff announcement to all selected training participants, like an internal memo from senior management or a webinar. And I also would ask you to look at the manager compensation and how workers' comp is built into that. Because I'm of the strong belief, that it should be lost time days or lost time costs versus the number of lost time claims. Because we don't want managers to think, well, I've had my lost time claim, I couldn't care less now what happens to this guy. He's already dinged me. So, and I'm open to help you folks get that through senior management as well. And I can provide consultation and training webinars, and I'm available for additional Q&A calls with yourselves or senior management. And this does include providing an abbreviated version of this presentation to your senior management if requested. You want to take this, Tom?
Yeah. So that, for the most part, concludes Bob's part of the presentation. And like he said, he's available to talk about this. It is for some fleets and some companies, it can be a pretty big cultural change to go from the initial reaction of deny, 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 and sort of one of suspicion, to one where it is much more one about really working with that employee to get them back into some sort of transitional duty, because it is going to dramatically cut your TTD costs. So thank you, Bob, for taking the time, one, to help us build this curriculum. It's a really fantastic curriculum, and it is a part of the ProTread Manager curriculum. For those of you that don't know, I will marketing will try to talk quickly here. ProTread Manager training is a separate product that we offer that is designed specifically for fleet managers as well as supervisors. It is a sort of separate license from your ProTread driver training, in that chances are you have a lot fewer managers than you do drivers. And some of the topics that we cover are reasonable suspicion, both for alcohol and drugs. That is, if you are managing drivers, that is a DOT mandated course that needs to be taken. we have a course that helps you prevent and deal with harassment, discrimination, and retaliation. We have a course on what to do if there is an active shooter in your workplace. It's a sad indication or a sad comment on society that we actually got several requests for this course, but we do. We also have a course on check rides and ride behind observations, so how to actually do an analysis of a driver's behavior by doing a ride along as well as ride behind. Same thing with forklift behavior observations. And then obviously we have the workers' comp for managers as a training course. And the way the manager training works is that it is available both per seat. So if you have much like our unlimited, what we call our unlimited driver training, where you can have all of your drivers take as much as they want, as frequently as they want, available per seat, or you can do it on a per lesson basis, where you'd buy a certain number of lessons that you can take over the course of a quarter. And so that concludes our webinar here. Bob's got a quick comment.
Yeah, and if you're interested in learning more or actually viewing the video trainings or purchasing them, send me an email, and I'll get right back to you, and we'll get things moving. But I think you'll find that they're very intuitive, very thoughtful, and again, it's one of the few training programs I've ever seen anywhere that actually gives managers the motivation to be more professional with their drivers. Questions?
Yeah, actually we did. We got a couple of questions. We actually got two different questions on the 50-mile issue in terms of, so can you talk a little bit about that rule and how it, like, I believe the specific question was, if you cannot bring them in from 50 miles away, is this a specific state law or a federal law?
No, it's state specific. It depends on, every state's got their own, of course, workers' comp system, and what they've done is people were trying to mandate, and I'll tell you why companies were trying to mandate this. They thought that'd be a good way to cut their benefits off, because under normal circumstance, if the employee refuses to return to work and they got a release from the doctor, you can stop their benefits, which of course with this program you'll never have to do. So the intent was that companies said, well, you live 60 miles away and you refuse return to work, so we're going to cut your benefits off. The states all came out and they adopted. They're different. Some states are 40 miles, some are 50 miles, or so on. It doesn't matter, because the purpose of this program is to connect that manager with that lost time employee. And I can tell you that as soon as the employee realizes that they're not being punished, or there's no anger left in the management, and their benefits you're not trying to cut benefits, you just want that person back to work, the employee will come back to work. And they'll come back. And by the way, as I said earlier, that in the very first slide, I think it was, our objective is to reduce not just lost time days, but transitional duty days as well. And so that's, what was the other question?
Another question, can you put them in a hotel near another office or headquarters or terminal and have them come in to do something?
Absolutely. Absolutely. But you still want the manager to, be talking to that employee once in a while, like just, hey, how are you doing? Are you feeling better? And establish that connection. But sure, you can do that. That's a good idea.
Yeah. And do you have some examples of some, savings achieved by a few companies? You don't necessarily need to, give them by name, but, talk about, programs that you walked into, changed, and how those savings worked?
Yeah. It's kind of, it's tough to get any kind of an incremental change in safety or workers' comp, it's tough. You see people that can claim a 10% savings in a number of claims and such, but this is focusing on the claim once it happens. And I'll tell you that at Roadway Express, in the first 12 months of using this program, it was a 45% reduction in lost time days, or paid TTD. The largest one, I know this sounds insane, but it was a 70% reduction in paid TTD, which represented a 55% reduction in workers' comp costs. But that company was very well managed, and they privately held company, and they took it to the letter of the law. But I've got, you know, again, it's when you get asked to fly down to Atlanta, Georgia, to do this presentation to actuaries, and that's what I'm hanging my hat on here, because when the actuaries believe your program, then it's true. If you cut workers' comp losses by 15–20%, they'll think, well, you did something, or it's a temporary fix. This is not a temporary fix. This happens immediately, and I hope you found this. Are there any questions?
No, I think we have seems to have worked our way through the questions. So thanks very much for your time, and everybody on the call for your time as well.